Hello, my support fibro friends. Doing this special presentation that I was unsure of how to deliver. I wasn't even sure of how to title it, but I want to make sure that everybody understands if you're tuning in live, I do not believe that fibromyalgia should be referred to as a trash can or wastebasket diagnosis. No, no, no. But I am coming across this quite a bit. And I recently made a comment in a Facebook Live. And since then, it seems like Facebook keeps sending me posts about fibromyalgia being a trash can diagnosis. It's really frustrating. And then I've also been looking at some other additional providers to speak at the fibromyalgia conference. So I'm always watching videos of the content, how they talk about fibromyalgia, and I'm hearing this come up a lot. So I decided to do this video very carefully. Now, I want to have a constructive conversation around this. I want to create change. I think this needs to be thrown out the window. So how do we encourage providers to let go of this, reframe the thinking, because there are unintended consequences to this language. This language is harming our community and we need to change it. And I want to encourage providers to reframe their thinking, join us in these advocacy efforts, change the thinking, take this and understand that we need the support, proper support, because consequences are happening and we have to switch this around. So I would love to have this conversation with all of you. I am Melissa Tolar. I'm the Executive Director of the Support Fibromyalgia Network, and I'm also a board-certified functional medicine health coach. I have very advanced training in functional medicine as a health coach, including functional nutrition and neuroscience. So when I hear stuff like this and how we need to create systemic change, I do kind of become Oscar the Grouch. So I'm going to do what I can. I know this feels a little bit like a soapbox moment and stuff. So I'll try to be as calm and collective as I can and not necessarily be venting or ranting, but it's an issue to me. And it's also been a personal issue that's come up, which I'll share a little bit later. Wastebasket diagnosis from Wikipedia, and you look around the internet and you understand the literal terms of this. And I've had recently some providers explain to me why the constellation of symptoms for fibromyalgia is the reason for a wastebasket diagnosis, and we need to do more. Now, I agree, we definitely need to do more, and we need to figure out if patients have autoimmune conditions or something else is going on, need to know if they have Lyme disease, but I do not believe that we need to be calling fibromyalgia a wastebasket diagnosis. And the medical community is often split on the best approach to managing a wastebasket diagnosis. The biggest challenge for a physician is maintaining their interest and desire to see the patient through their illness. So this is a big deal in the fibromyalgia community. I also highlighted a point here: as diagnostic tools improve, when we have better research, we get better diagnostic tools, then things change for these wastebasket diagnosis, and they get properly defined and reclassified as a clinical diagnosis. I want to point out, though, that there is diagnostic criteria for fibromyalgia. I know there's disagreement that it's not great and wonderful, and we still need investment in research to do better. I am in agreement in this, and I do agree that we need to do proper testing to make sure we have the correct diagnosis. But that does not mean that people are not diagnosed with fibromyalgia, and this just throws me off. I think we need to get rid of this phrasing for even some of the other diseases mentioned in here. They're very painful diseases, and we have to take these seriously. We have to take pain seriously. Here's an example of a post I saw recently that jumped up into my Facebook feed. This is a real post by a doctor, and this is why I'm pleading with our providers, please change the language, because we agree that patients need proper care. I agree that we need to look at autoimmune conditions as the possible symptoms for why this is happening. It may not be fibromyalgia diagnosis, or you could have an autoimmune diagnosis and you could have fibromyalgia. So this is the updated criteria from the American College of Rheumatology. Fibromyalgia should definitely be considered a diagnosis of inclusion. And I know there's always going to be mechanisms that are going to manifest a disease, which I will get into shortly, but it's not a trash can diagnosis. And I want to give a shout out to painscience.com for very eloquently sharing about being a diagnosis of inclusion. And I will share the page because we have to understand that fibromyalgia can and does coexist with similar conditions like rheumatoid arthritis and lupus. So it would be a mistake to consider fibromyalgia only in their absence. You might miss that fibromyalgia is also going on. Or on the flip side, a lot of people might get its fibromyalgia diagnosis and all these symptoms are put under the fibromyalgia category. And there's not a further investigation as to what else might be happening. And I know it gets confusing with things like Lyme disease, with EDS, with autoimmune conditions, because with autoimmune conditions, it does take a little bit of time as you're starting to get symptoms and you're starting to see little stuff in your blood work, but there's not a conclusive diagnosis. So we need to acknowledge this and in the community, but we can't just throw the diagnosis of fibromyalgia out the window. 10 million people around this country have been diagnosed with fibromyalgia. Maybe that wasn't the best way to describe the symptoms going on, but if we can't change that, so let's move forward and create solutions for our community. And it's super important that we do focus on the solutions for fibromyalgia and fibromyalgia as a diagnosis. And so, for example, if you have a diagnosis of lupus and you're properly treated for the condition, to the extent you may not have a lot of evidence of active disease, but you could still have symptoms that match those of fibromyalgia. So it is reasonable to still consider a fibromyalgia diagnosis in this person. So that's what we get. It is confusing. We have to update our public health websites to match the American College of Rheumatology. I think they have the most advanced and updated criteria for diagnosis when it comes to fibromyalgia and how it's found in other conditions. But this is where we need to start updating and training our providers. We are working on that through Project Echo. But we have to start somewhere. So let's start with the grassroots movement of campaigning to get rid of this word choice. And a lot of people throw root cause medicine around. This is what I saw. I hear that fibromyalgia is a trash can diagnosis. We need to get to the root cause. If you are a trained functional medicine provider, you know that fibromyalgia is a diagnosis and there is a root cause. And so I share this tree, this functional medicine tree, because you have all these symptoms manifesting. You have a diagnosis that's manifested. So the disease burden is really large in scope with this patient population, and you can get to the root cause of that diagnosis, of that disease. You help the patient follow through. You can do it with your clinical knowledge and do clinical treatments that might help multiple modalities. I'm a coach, a health coach. I focus on behavior change, lifestyle modifications that patients can do on their own. So we're addressing the root cause. It just so happens that the diagnosis is fibromyalgia, but we can still treat the root cause even though we have the diagnosis of fibromyalgia. And we can change the diagnosis and we'll still have root cause medicine. It can be diabetes, right? There's root cause medicine. Lupus and fibromyalgia, we can still address root cause. Alzheimer's, root causes. And I bring up Alzheimer's in particular. If you are already familiar with functional medicine, you're familiar with the End of Alzheimer's book and Dr. Dale Bredesen and the Bredesen Protocol. Recode, trained in Recode 2.0, know this very well. And this book really helped me reclaim my health, but also reframed my thinking because of the different contributing factors. So in the book, he refers to 36 contributing factors that manifest into Alzheimer's disease and an Alzheimer's diagnosis. So if you can optimize this 36 holes in the roof is what he calls it. So these 36 contributing factors that he found in this first book, there's been more advanced research too with what he's done and these different types. But if you can optimize those contributing factors, decrease that disease burden, then that's what we're looking at, root cause medicine. But the diagnosis is Alzheimer's. The disease is Alzheimer's, and there's all these contributing factors. So why can we not say the same for fibromyalgia? Why can't this title be the end of fibromyalgia? With 36 contributing factors to fibromyalgia, we figure out what those contributing factors are. We help patients optimize those factors to decrease the disease burden of fibromyalgia. Can we get there? Is it possible? I believe it is. And I've been really motivated by Dr. Dale Bredesen and Dr. Terry Walls' work in functional medicine, addressing the root cause of disease, but there is a diagnosis. And for us, the diagnosis is fibromyalgia. And I hope that makes sense because it's a really important point. And I want to distinguish that when I hear people talk in their videos. And I'm like, wait, we can address the root causes of fibromyalgia and how you get the diagnosis of fibromyalgia. And again, I think we're all on the same page here. We want to decrease the disease burden. We want to improve the patient's quality of life. And I know nothing is done from malicious intent, but there are just these unintended consequences for these words. Words have the power to harm. So there are systemic forces that have caused these challenges, and we need systemic solutions to help people combat them back, right? And I understand providers are burnt out in this medical system. Reimbursement is super low. You don't spend a lot of time with patients. I just want to acknowledge that, but I want to welcome providers into this discussion. Let's have a constructive conversation about how we change this language and how we help create a healing community through this struggle. Here's a picture of some of the faces that have been advocating with us on Capitol Hill, have been making an energy and time investment to do the work to create the solutions to get a strategic investment in fibromyalgia. And I invite everybody that can to join us in advocacy efforts, including our providers, so you can actually witness and hear the stories of patients living with fibromyalgia and how debilitating this disease burden can be: low quality of life, chronic widespread pain, unrefreshed sleep, fatigue, stomach issues, brain fog galore. This is happening within our community. Over 10 million people have been diagnosed with fibromyalgia, and we really want to bring the quality of change we need to the community. So here's some of these consequences. We're asking our representatives to get the NIH and these public health agencies and government agencies to make a strategic investment. So we're having them focused on fibromyalgia specific research. And if we collectively come together and recognize that fibromyalgia is a real diagnosis, this helps this cause too, because you would never pitch someone for investment. If you've ever pitched someone for your startup company or your business, you would never walk in nonchalantly and be like, can you please invest in a wastebasket diagnosis? So it's not helpful. It does not help us in the long run of making a strategic investment. As we go to Capitol Hill, we're asking for this strategic, sustained investment in fibromyalgia because we need accurate classification. As I said, with the wastebasket diagnosis terminology, what if we get that accurate classification? Better classification, pathophysiology as it's starting to develop. We see neuroinflammation studies come up. We need larger cohorts of studies. And I get excited when I see this new research, but we need to drive home the sustained investment for a better future for our fibromyalgia community. Biomarkers research, translational treatments that can be translated. Research is translated into a clinical setting to help patients better decrease the disease burden. Even specialist training, funding to help providers get trained to be specialized in the treatment of fibromyalgia. And think about this, patients don't have to travel 4 hours or fly across the country or look for a fibromyalgia specialist. They can find it in their hometown because you get the training for free, like things like Echo, where we can give you the guidance and train and updated information on fibromyalgia training. You can get continuing medical education credits and you don't have to move around the country. You can get it for free. This is where grant funding also comes in to help with that increased specialized training, with finding specialists that are willing to work in the fibromyalgia community, bringing them in. Also, additional grant funding for things with classification. And I know there's a major discussion on where fibromyalgia is going to land with classification, new stuff, right? If it's a neurological condition, is it part of the immune system? Is something going on in the immune system? Where does it fall? And there's ways to open up grant funding for different centers. So there's brain health centers across the country. So can we get fibromyalgia patients into there for clinical or for research or clinical care? Like, this happens to spread across the country. Again, we're improving quality of care for all the fibromyalgia patients across the country. And I'm hoping it'll translate to our international friends too. Some of the international friends seem to be in countries that are more advanced right now in their investment in fibromyalgia. So I would love to see us contribute here in the United States to advancing for clinical care and for research in fibromyalgia moving forward. But this is why we need to have our representatives truly believe that fibromyalgia is real. The quality of life is such a burden. We are burdened with this disease so heavily that we need the support and we need the help, because this is actually the truth of the matter, and this is how we get things done for the community. Also wanted to share the effect that it has on disability services. And I don't just mean this by applying for disability, but I have a personal story to share around this. So I was in college and I was trying to get services at the disability center. At this point in time, I'm not really aware of advocacy. I don't really understand how this works for getting disability services on my college campus. And I was told to get information from my doctor about what fibromyalgia was, because the definition wasn't as widespread, awareness wasn't as big as it is now. So maybe more people are still aware now more than ever of what fibromyalgia is. But in my case, that wasn't happening. So when I came in and, I had the doctor fax over to the office, the woman, she showed me what was written about the definition that the doctor wrote. And in there, the doctor it says that fibromyalgia is a wastebasket diagnosis. It's not a real diagnosis. So here I am trying to apply to get disability services on the college campus. And my doctor has given her the definition, and she is like, well, if it's not real, then why would you need disability services? And this really happened to me. And that's why it hurts my heart. I did advocate, figure out what that meant back then to get the services I need. Fortunately, she believed the situation because it was real and I was able to do this. But it really resonates with me and really does hurt my heart that someone in the country may be dealing with this right now. And it's not fair. There's no justice to this. And we're really impassionate about changing this, because that should not be the definition. If you're needing services and it hurts on a systemic level, and this is why I'm really pleading with the provider community to understand what's happening. And it's happening across the country. And here's some of the populations that get really affected by this because they get dismissed. Gaslighting is prominent in our community. So populations of people, the patients that are coming into a clinical setting that are already undertreated, low income areas, rural parts of the country. So if other providers are telling these providers that it's a trash can diagnosis, they end up getting dismissed even more because they don't know then what to do next. There's not enough education going around for patients to educate. Like, it's hard. We're trying to educate patients in our network, but there's not enough resources yet to start educating providers all around the country, all around the world to make changes. And this is a huge issue. And I know sometimes I see it from providers that do fee for service, and it's really coming up like fibromyalgia trash can diagnosis. Let's get to the root cause. Buy my program, sign up here. A lot of people cannot afford these services. So we have to be mindful of everybody that has a diagnosis of fibromyalgia and understanding how it systemically hurts when we create this harmful language. And another area is women of color, especially. And I've heard the worst horror stories of clinical care from our population of women. And it's really jarring to hear that when they walk into an office with a provider and they say, I have been diagnosed with fibromyalgia, the first thing out of the provider's mouth is fibromyalgia is a wastebasket diagnosis. But then, okay, if that's the take of it, then I would imagine the scenario that they would dig in to do more baseline blood chemistry panels, figure out where these symptoms are coming from. But unfortunately, that doesn't happen. So you get dismissed, you get out the door, and we already know that women's pain is already undertreated in this country. It's documented. More research is coming out about how women in pain get dismissed. And then on top of this, we know that serious racial disparities exist in the U.S. healthcare system. Then according to the U.S. Department of Health and Human Services, Black and Hispanic people receive worse care on 40% of the department care quality measures. Racial disparities are particularly striking in women in pain treatment. So we already know this. And so contributing to that was saying like fibromyalgia is a wastebasket diagnosis. We're just exacerbating a systemic issue that already needs to be corrected. And then a whopping 25% of people who have lupus also have fibromyalgia. So this is a good reminder that we need to dig in depth. I'm not disagreeing with doing more work if there is a diagnosis of fibromyalgia, because understanding the differences, and this is where we need to get better at training our providers in differentiating between different diagnostic criteria, why the manifestation of lupus and fibromyalgia together, what does that look like? And we need to be aware of that, but we also need to understand when we create this dismissal with women of color, organ damage and autoimmune diseases is really severe. And we need to make sure that they get the full workup in a primary care setting, or they get the referrals they need to a rheumatologist. They're not just sent out the door. So it really does matter the language that we use. And we can do this. We can change the community together if we all work together. And I do want to close it out that I do get told all the time, and I'm really trying to figure out which battles to fight in my conversation and how to educate healthcare professionals better when it comes to their answers. And I had a situation where we had a booth. This is pre-pandemic in the Bay Area at a gluten-free festival, and Suzanne was with me. We were all like, oh, let's go introduce ourselves to the provider that's speaking and take my card, say hello. We're part of the Support Fibromyalgia Network. I was about to hand him my card, and he's like, fibromyalgia is a wastebasket diagnosis. That's the first thing out of his mouth. No, hello, nice to meet you. I mean, he could have just taken my card and not said anything, right? So it's hard, and it's not the first time that's happened to me before, and the dismissal you get when it comes to fibromyalgia. And this is why I thought maybe hoping to go into being a health coach would help with communicating to healthcare professionals. I think I've become a little bit more jaded than I thought. So this is happening a lot. How can we create more constructive conversations to change this? Thank you so much, Support Fibro friends. I would love to hear from you. I'm Melissa Talwar from the Support Fibromyalgia Network, and I'm also a board certified functional medicine health coach. Talk to you later.